And a new study in the Boston Globe is highlighting the disparities in pain control prescriptions for elderly Black and Hispanic patients with terminal cancer compared to white patients. The study from the Dana-Farber Cancer Institute found that both Black and Hispanic patients over 65 received fewer opioids for pain relief near the end of their lives. Emergency medicine physician and ABC News medical contributor Dr. Darian Sutton joins me now for more on this. Dr. Sutton, thanks for being on. What do you make of these numbers?
Well, good morning, Diane. This research looked at over 300,000 opioid orders for, as you said, Black patients and white patients, all patients who have been treated over 20 years. And it found that Black and Hispanic patients were about 3 to 4% less likely to be prescribed opioid prescriptions compared to their white counterparts. And although that number seems relatively small in context, only approximately 30% of patients in total are ever prescribed opioid prescriptions. More concerning, Diane, is that it also found that Black patients who were prescribed opioid pain medications tended to be prescribed lower doses compared to their white patients.
Now, according to this new study, Black patients with cancer are more likely than any other group to undergo a type of urine screening before being prescribed these opioids. Why is that?
Well, drug testing and drug screening has been previously recommended to help decrease the dependence on opioid prescriptions, but there have never been any specific guidelines. And unfortunately, when there are no guidelines, that subjects patients to the individual bias of providers. And as you said, Black patients, specifically Black men, were the most likely to be drug tested and the least likely to be prescribed treatment.
Now, this study looked at data from 2007 to 2019. So have things improved at all since then? And what do you think can be done to address this?
It's hard to say. Unfortunately, there hasn't been much of any change, and we have yet to see the data from the most recent times. We do know during the COVID pandemic that Black patients were 2 to 3 times more likely to get infected and had significantly increased risks of hospitalization and death. What we have to understand is that the assessment of pain is inherently an objective assessment, and it's based on not just the past education of the provider, but also the past influences, past experiences, and cultural effects in a world that is deeply embedded with systemic and structural racism. So the first and foremost thing is identifying that, then measuring it. You can't measure something, you can't change something you're not measuring. And so more data and more research needs to be done. And then also education, implicit bias education, diversity education inside schools. And then lastly, specific guidelines like we were discussing for drug screening to help remove that individual bias that patients are subjected to.
All right, Dr. Darian Sutton, we appreciate it as always. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.